In January, Elon Musk announced that for the first time, his company Neuralink implanted a brain chip in a human as part of a preliminary clinical trial.
Every day, breakthroughs in science are transforming various fields and industries. So how do you keep up with the latest trends in this ever-evolving landscape? Here are some hot topics to keep an eye on: the rapid growth of green chemistry, the clinical success of CRISPR technology, the increasing use of biomaterials, and exciting advancements in treating previously untreatable conditions like cancer and neurodegenerative diseases. These are the game-changing trends and innovations of 2024. Let's dive in. The rise of AI in research and development. AI is transforming R&D, especially in chemistry and drug discovery, even though its full potential hasn't been reached yet. Despite some setbacks, significant breakthroughs are making waves. Generative AI is now playing a big role in drug discovery, machine learning is getting more involved in environmental research, and large language models like ChatGPT are being tested in healthcare and clinical settings. A lot of eyes are on AlphaFold, DeepMind's groundbreaking protein structure prediction software that has revolutionized our understanding of proteins. DeepMind and Isomorphic Labs recently announced that their latest model boasts improved accuracy and can predict structures for almost all molecules in the protein databank. It also expands its reach to include ligands, nucleic acids, and post-translational modifications. To the moon and beyond, NASA's global Artemis program is gearing up to make history by landing the first woman and the first person of color on the moon by 2025. This mission is a step toward the bigger goal of creating a sustainable human presence on the moon. But that's not all. In 2024, NASA's Europa Clipper will head to Jupiter, aiming to explore Europa, one of its moons, to see if it might be habitable. Meanwhile, China's Chang'e 6 mission is set to bring lunar samples back to Earth, and Japan's JAXA plans to collect samples from Phobos, one of Mars's moons, with its Martian Moons Exploration (MMX) mission. Plus, Boeing also sent astronauts on a test flight of its reusable space capsule, Starliner, to low Earth orbit. Unfortunately, those astronauts are now stuck on ISS. You can find the link to that video in the description below. Greener chemistry gets even greener. Green chemistry is on the rise, constantly finding new ways to reduce the environmental impact of chemical processes. Here are some exciting trends making waves. Better predictions for greener outcomes. One major challenge in green chemistry is accurately predicting how new chemicals and processes will affect the environment. Researchers are creating advanced computational tools and models to improve these predictions. This will help chemists design safer and more eco-friendly chemicals. Cutting down on plastics. With over 350 million tons of plastic waste produced each year, reducing single-use plastics and microplastics is crucial. Innovators like Matero are leading the way by reusing industrial byproducts and biomass waste to create eco-friendly, cost-effective plastic alternatives. This shift towards reducing plastic footprints and lowering costs is becoming a standard across the supply chain. Rise of biomaterials. New biomaterials are set to revolutionize healthcare in the coming years. A standout is bioelectronic materials, which bridge the gap between electronic devices and the human body. One exciting example is Neuralink's brain-computer interface system. Using biocompatible electrodes implanted in the brain, this system got FDA approval for human trials in 2023. The CRISPR payoff. After years of research and setbacks, CRISPR has finally proven itself as a powerful therapeutic platform. Intellia Therapeutics got FDA approval to start a crucial Phase 3 trial for a new drug treating Hatter. Using the same Cas9 mRNA, they also developed a treatment for angioedema by tweaking just 20 nucleotides of the guide RNA. This shows CRISPR's potential as a versatile therapeutic tool in the clinic. Another milestone came when Vertex and CRISPR Therapeutics received authorization from the UK MHRA for Casgevy, the first CRISPR/Cas9 gene-edited therapy to treat sickle cell disease and transfusion-dependent beta thalassemia. This approval marks a historic moment, showcasing CRISPR's potential to transform human health. Beyond its gene-editing prowess, CRISPR is making waves in early cancer diagnosis. CRISPR-Cas systems, including CRISPR-Cas12a and CRISPR-Cas13a, are showing promise as robust tools for cancer therapy and diagnostics. Ending cancer. The field of immuno-oncology has been booming over the past few years. We've seen a surge in market size for approved treatments like cytokines, vaccines, tumor-targeting monoclonal antibodies, and immune checkpoint blockers. One of the exciting new therapies in clinical trials is TAK-01-HER2. This innovative approach uses a patient's own T cells, genetically modified to include T-cell antigen coupler, TSC receptors. These receptors specifically target the HER2 protein on tumor cells, aiming to eliminate them, which could be a breakthrough for treating metastatic HER2-positive solid tumors. Another promising strategy combines CAR T cells with a vaccine that enhances the immune response. This immune boost helps the body generate more T cells to attack tumor antigens that CAR T cells alone can't target. This dual approach could significantly improve the effectiveness of cancer treatments. Tackling neurodegenerative diseases. Neurodegenerative diseases are a critical public health issue, ranking among the leading causes of death and disability around the world. While no cure currently exists, new scientific breakthroughs and a deeper understanding of disease pathways are offering hope for better patient outcomes. Alzheimer's disease. Recent developments in Alzheimer's treatment have brought some exciting progress. 2 immunotherapies have received FDA approval for their ability to slow cognitive and functional decline in people with early Alzheimer's. In 2021, aducanumab made history as the first new Alzheimer's treatment approved since 2003. It works by targeting the disease's underlying mechanisms, specifically reducing beta-amyloid plaques in the brain, which are associated with Alzheimer's progression. Following this, in 2023, lecanemab received traditional approval and became the first drug of its kind to show tangible clinical benefits. It has been proven to slow the progression of the disease and reduce the rate of cognitive and functional decline in patients at the early stages of Alzheimer's. Parkinson's disease. Parkinson's disease remains a challenging condition, but recent strides in treatment options are providing new hope. Beyond traditional pharmaceuticals and deep brain stimulation, innovative approaches are gaining traction. For instance, in 2021, the FDA approved Exablate Neuro, a groundbreaking non-invasive device that uses focused ultrasound to target one side of the brain. This technology offers significant relief from severe Parkinson's symptoms, including tremors, limb rigidity, and dyskinesia, without the need for invasive surgery. 2023 marked a major breakthrough in Parkinson's research with the validation of a crucial biomarker, alpha-synuclein. Researchers have developed the A-synuclein seeding amplification assay, a tool that can detect this biomarker in spinal fluid. This test is significant because it can identify the presence of alpha-synuclein in individuals who have Parkinson's disease, as well as in those who are at risk but haven't yet shown symptoms. Thanks for sticking with us until the end, and I'll see you next time. Until then, stay safe and goodbye.